The 43-year-old stay-at-home mother, who suffers from diabetes, anxiety, and depression, is one of more than 400,000 low-income Kentucky residents who obtained Medicaid coverage under President Barack Obama's 2010 Affordable Care Act. Barr's vote last year to repeal Obamacare scared Anderson. In 2016, she said, her top concerns were jobs and the economy, having grown up in a family of coal miners. Now, she worries about losing Medicaid and about work requirements introduced by the state's Republican governor. Kentucky's 6th Congressional District, where two well-funded Democrats are running in a May primary to see who will stand against Barr in November, has in recent years gone solidly Republican. Barr won 61% of the vote in 2016. Republicans say they are confident that Barr's support will remain solid this year. Both Democratic candidates are currently too busy fighting each other over who's the biggest progressive, a surefire way to lose in a district where voters don't subscribe to their liberal brand of politics, said Jesse Hunt, spokesperson for the National Republican Congressional Committee. But many analysts see enthusiasm for the party weakening in the district and have identified it as one of several dozen seats Democrats might be able to pick up in the House of Representatives. Democrats believe that voter concerns over rising medical costs and Republican plans to cut Medicare and Medicaid will assist them in their fight to retake the House and are urging candidates to emphasize the issue, particularly in swing districts. Protectors of health care residents of Kentucky's 6th District, home to both the city of Lexington and to rural towns struggling with the loss of coal jobs, have reason to focus on health care. People there suffer from lung disease at rates that far outstrip those in the rest of the country, and drug overdose rates in parts of the district are among the highest in the nation. Obamacare is a good thing, said Jerry Harris, 66, who likes the job Trump is doing but describes himself as a Democrat. He relied on an Obamacare exchange plan before he was eligible for Medicare and has a daughter on Medicaid. I want to hear candidates talking about bringing down costs, he said. Democratic candidates nationwide are being encouraged by the party to cast themselves as protectors of health care. Last month, House Minority Leader Nancy Pelosi urged congressional Democrats headed home for the spring recess to focus on Republicans' relentless efforts to dismantle the health care of seniors and families across America. Barr's main Democratic challengers feature health care as a top concern on their campaign websites. One of them, Lexington Mayor Jim Gray, says his number one issue is protecting and fixing health care. We cannot go back to a time when the insurance companies called the shots and denied coverage for pre-existing conditions, he writes. The Democrats' other top contender, former Marine fighter pilot and mother of three, Amy McGrath, says Barr has failed to deliver meaningful health care reform. For years, she says, Republicans promised to repeal Obamacare and replace it with something better. That's the reason I'm running, I'm tired of the lies, she said in an interview. Barr's campaign website focuses on themes Republicans are emphasizing this year: cutting government spending, balancing the federal budget and creating jobs. His vision section does not mention health care. His most important message this year, he says, is economic. When the people that I represent sent me to Washington, they wanted me to focus on growing the economy, Barr said in an interview. We've done that in a dramatic way. On health care, Barr said he believes voters are still angry over rising health insurance costs under Obamacare and that his message that the program has failed still resonates. Barr also warns voters that, with Democrats in control, bureaucrats in Washington, D.C. will be in charge of your personal health care. Lens of their own lives. More than 24 Republicans and Democrats interviewed in Kentucky's 6th said they were dissatisfied with current policies, but their ideas for reform did not necessarily dovetail with their party's platforms. Former horse trainer Mary Bennett, 45, for example, said she voted for Trump but has not decided whether she will vote at all in November. Like many Republicans, she says Congress should get rid of Obamacare. But her ideal solution is one embraced by the most liberal of Democrats: put everyone on Medicare. both Democratic and Republican strategists acknowledge that views on healthcare are complicated. I don't think people generally look at healthcare and regurgitate the Republican view or Democratic view, said Matt Makowiak, a Republican consultant. They look at it through the lens of their own lives.